Hello everybody, how you doing today? It's Dr. Russell Brockstein, your top-rated Freehold, New Jersey chiropractor. And before I get into our topic today, I just wanted to wait a second to see if anyone gets on board. It's a pretty important topic that we actually had two fairly new patients come in the past 2 weeks and brought up this topic for me to do this video. So anyway, a lot of patients present with pain, back pain, neck pain, headaches, sciatica, numbness and tingling down the arms or the hands, and a lot of times doctors don't do a full thorough evaluation to determine what the cause of the problem is. So the last 2 weeks we had two patients come in and they were both experiencing back pain. And both before coming to myself and seeing a chiropractor, both were seeing pain management doctors, orthopedic surgeons, physical therapists, and it just turns out no one was doing a full, thorough evaluation to find the cause. In both instances, actually one instance, patient didn't have any type of diagnostic tests done at all, and they were just randomly treating her left and right, just throwing different forms of therapies at her, electric stim, muscle work, massage therapy. But the other one was even more interesting. Severe low back pain, fairly young, in her 20s. And the orthopedic doctors, rather than doing an evaluation, they just sent her for an MRI, just assuming that because it's lower back pain, it's going to be a disc problem. So they sent her for the MRI, and the MRI shows that there is a bulging disc. I read the report. It's mild, on the mild side for the disc, but no evaluation was done to determine whether the disc itself was the cause of the pain. And there's different ways of doing an evaluation. As a chiropractor, there are different chiropractic evaluations, but also as a chiropractor, we learn orthopedic tests, okay, which you would think an orthopedic doctor would do. Now, the orthopedic doctor that this patient has seen, and many orthopedic doctors that I've had patients go to, it just seems like they very rarely do these orthopedic tests anymore. And these tests are to stress the integrity of the areas. So there are multiple tests, 3 or 4 different tests that we can do to test the integrity of the disc. So this particular patient, because the MRI showed a disc problem, they just decided to shoot the disc and area with cortisone. First of all, there's many reasons why not to do these epidurals and cortisone shots. They're just dangerous. At best, they mask the symptoms. But there's more and more warnings by the FDA and studies show, just don't get epidurals and cortisone shots. They should be a last resort, not a first resort. Now going back to the MRIs, if you take the general population and you send people for an MRI of the lower back, more than 50% of people with no pain are going to show a bulging disc, okay, or a herniated disc. So most of the time these herniated discs are not symptomatic. Now, as a chiropractor, I believe that everybody should be adjusted, because it's just like going to the dentist. If you go to the dentist, you don't wait till you have pain, but you usually go for your yearly or your biannual checkup. And there are many times the dentist can find a cavity before you even feel it. And you're not going to tell that dentist that, don't worry about the cavity, I don't feel it right now. You're going to want the dentist to take care of it as soon as possible. Otherwise, it's going to get worse and worse to the point where you will have a painful tooth, and the amount of work that you need is going to be that much more. It's very similar with the disc problems. If you don't take care of a disc early on, and while it's asymptomatic, it's just going to get worse. It's almost like a bulging a bubble on a tire, okay? So on your car, if you have a bubble on a tire and you don't take care of it, eventually that bubble is going to burst. So what I want to get into, where this particular patient at the MRI was done, the MRI shows a bulging disc, so they're just treating her for that. But if you do all the different orthopedic evaluations on this particular patient and do chiropractic evaluations, you would actually find that the disc isn't the problem. This isn't what's causing her pain. The pain was actually coming from a different spot. With this particular patient, it was actually the SI, or sacroiliac joint. So, not surprisingly, once we started working with her and we started doing chiropractic adjustments to the spinal region, to the SI joint, lumbar region, and also adjusting the ankle, feet, and knees, immediately after the first visit, she started getting results. She's already getting relief. Yesterday was only her 4th visit, and she still has some pain, and unfortunately, the orthopedic surgeon that she's going to is telling her that even though she's still feeling pain after just 4 visits, it's very important that she gets the surgery now. You have to realize, when you go to an orthopedic surgeon, where are they going to make their money? They're going to make their money from doing surgery. So, trying these conservative type cares like chiropractic, if it gets a patient better, it's going to cost a surgeon, $20, $30, $40, $50,000. All right. But the surgeries also have a very low success rate. Most spinal surgery studies are showing are going to give you at best a 50% chance of recovery. Okay. So it's almost like flipping a coin. Do you want to take that chance with surgery? And then on top of that, the successful surgeries are usually at best giving 1 to 5 years of relief. So after 1 to 5 years of relief, and if the pain starts coming back, guess what the surgeon's going to want to do? More surgery. So yesterday the patient came in with the father, and the father was like really concerned, and I said, I find it interesting that you did 3 times a week for over 2 months of physical therapy, having multiple cortisone shots, had no relief at all, but they weren't pushing you towards surgery at that point. But after just 4 visits in a chiropractic office and having 20 to 30% improvement already, and that was before her 4th treatment yesterday, they want to rush to surgery. The father's concerned, doesn't want the surgery, and I said, if we're already getting results so quickly, we got to do more active treatment, do the chiropractic adjustments, going to do some therapeutic stretching, and then we're going to do some core stabilization exercises to strengthen and stabilize that area. We want to keep this young woman active, okay, so she can enjoy, she has a long life ahead of her. We want her to enjoy her normal daily activities. So by taking a more proactive approach of chiropractic and finding the cause first of the problem and treating the actual cause, we can get results where other doctors and practitioners don't. Okay, so I just wanted to bring this awareness to you that just, when these doctors are sending out for different x-rays and MRIs and if a bulging disc shows up, and if they're not correlating it with the findings of a full, thorough evaluation, a lot of times it might not be that disc. Okay, so we got to actually treat the cause to get the best results. I hope this made sense to you. If you have any questions, please comment below. If you're on Facebook or even Instagram, show a little love, click the heart or click the thumbs up button, and make sure you share this information with others. Most people don't know what these doctors are doing just by treating symptoms, not treating the cause. And we want to help as many patients as possible. I just wanted to get this out to you before I have to rush to my next patient, because it was on the top of my mind after seeing 2 fairly new patients in a fairly similar situation. Surgery should be a last resort. It should not be rushed into. Chiropractic has great results, as one of the highest satisfaction rates, and more patients have to be aware of the benefits of chiropractic. We are the spine specialists, And it's a lot more than just pain relief, but also improvement of the function of the body, the nervous system. Your nervous system controls every function of the body. So a lot of patients that come in, not only do they get the pain relief, but they also start noticing that they're healthier, have more energy, sleeping better, and it just improves the quality of life. Okay, so signing off for now. Thank you very much for watching us. Have a great afternoon, and we hope to see you soon.